much, Mr. Williams, and a warm good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Committee's situation report for today, Monday, June the 21st. We are in the middle of the COVID-19 pandemic. The virus has been reintroduced into our federation, and at present, we are experiencing a COVID-19 outbreak. The first case in this current wave was identified on May 19th, and so over this past month, a total of 305 COVID-19 cases have been added to the Federation's COVID-19 tally. So over this past month, we've added a total of 305 cases to our tally. During this same period, there have been 30 recoveries. So 30 patients have recovered completely from COVID. At present, we have 273 active cases. These active cases are being monitored by a cadre of case managers and physicians. Over this same time period, we have had 21 hospitalizations or admissions to the COVID ward at the JNF General Hospital. 10 of these patients have since been discharged, and at present, we have 9 persons remaining on the COVID ward at the JNF General Hospital. There are 2 COVID-19 related deaths. The first was announced last week, Thursday, June 17th. The second occurred within the last 24 hours. This slide provides you a summary of the number or the newly diagnosed cases each day and over the past week. And so on June the 19th, we received 11 positive results, COVID-19 results. I want to just explain that this 11 includes 2 inmates at Her Majesty's prison, and so we now have 2 additional inmates being positive for COVID-19. This 11 cases identified on the 19th also includes a family cluster of 5 persons. So this just gives you an idea as to the number of newly diagnosed each day over this past week. Now, I just wanted to share some additional information. Most of the recent cases, they fall within the age band 20 to 49 years. So that's 20 to 49 years. But the range goes from childhood, 0, just a few months old, to 80 plus. So this gives you the age range of the most recent cases that we've added over this past month. And in terms of the gender breakdown, it's somewhat equal, 51% female, 49% male. So, ladies and gentlemen, to date, we would have reported 350 confirmed cases of COVID-19, 15 cases recorded in Nevis, 335 cases recorded St. Kitts. And as I said before, since we've been responding to COVID-19, we have a total of 75 cases fully recovered, and that's from 2020 to present. 273 active cases, 9 hospitalizations, and 2 COVID-related deaths. This just highlights that just underscores what I just said, that we've identified 2 additional inmates with COVID-19. That brings the total to 39. So at present, the outbreak at Her Majesty's prison now involves a total of 39 inmates. Please note that these inmates, the affected inmates, they are all isolated and they are being monitored by the matron of the prisons in collaboration with the cadre of case managers and physicians who are monitoring all the active cases. What's the way forward? Now, as we respond to this outbreak, we have employed 4 of the public health interventions. Contact tracing, our robust contact tracing process continues. We continue testing, and more testing. We continue our COVID-19 vaccination rollout, and Superintendent Henry just underscored the terms of the restriction of movement. In terms of our contact tracing process, to date, the public health team, we engaged over 2,100 contacts already. They have been interviewed, placed in self-quarantine. Over 1,300 such persons have been released from self-quarantine, and at present we have over 790 individuals remaining in self-quarantine. So our contact tracing process continues. It's robust and it is working, because to date we have contained the outbreak to a degree. Just through our contact tracing process alone, we've picked up those positive contacts who, if we weren't contact tracing, they would have passed on the virus to other contacts, and our numbers may have been like 3-4 times what they are right now. So we will continue our contact tracing process. Next. Testing to date, within this past month, we tested over 7,400 persons. Well, let me just repeat that. We've conducted 7,417 tests. So 7,417 samples have been processed. Some persons were tested repeatedly. So it's not persons, but samples processed. I want to underscore that 15.7% of our population have been tested within this 1 month period. Next. Now, in terms of vaccination, we continue our vaccine rollout, and within this 4-month period, 67.5% of the target population have been covered with the first dose, and 33.9 or 34% of the target population covered with the second dose. In other words, 11,205 individuals are now fully vaccinated, and so that's good. Now, persons are expressing alarm regarding the numbers that we report daily. But what are the numbers really telling us? Well, one, it's telling us that our contact tracing process is working, because most of the recent cases are contacts of recently identified cases. And so our contact tracing process is working, but it also tells us that the contacts of cases, they are not adhering to the non-pharmaceutical measures. Because if they were, they wouldn't have picked up the virus. And so what we need to do is to really fully understand what it means to live day to day in the context of COVID-19. How is it? How do we live in the context of COVID-19? What changes do we have to bring to bear to be successful in terms of protecting ourselves from this virus? So in essence, based on the stay-at-home order, we have to shelter in place. So in other words, you need to remain at home. You are only expected to move if it's for essential purposes. And so if you're an essential worker, you have to go and work. If you need food, you can go to the grocery stores, you can pick up food. You can go to the bank. So we want you to stay in place. However, if you must move, please wear your mask at all times. Always wear your face mask. And these days, now that we are in community spread, I usually wear a surgical face mask because that provides you even better protection as compared to a cloth mask. So always wear your face mask. So if you're an essential worker, you're leaving home, you're going on the bus, you're going to the grocery store, you're going to the pharmacy, you're going to the bank. Keep on your face mask, very important. You need to sanitize your hands after touching high-touch surfaces. So if you're going to the bank, you have to open the door. If you're going to the pharmacy, you have to push the doorknob to get in. If you're using a communal restroom, you need to note the faucets, the toilet handles, the sink covers, etc. You need to sanitize your hands after touching high-touch surfaces. Now, sanitize your hands after leaving the grocery store. That's very, very important because you would have held the basket or pushed the trolley, and so you need to sanitize your hands before, because there's a sanitizer station on entering the grocery store, but you need to sanitize your hands after leaving the supermarket. When you get home, you need to sanitize your grocery items, pack them away, and then sanitize your hands again. So it's important to maintain good hand hygiene. So I just thought today I'll explain in more detail, how much you need to sanitize your hands to protect yourself from the virus. You need to maintain a safe distance of 6 feet from others. When we look at the numbers and we realize that these are contacts of cases, it means that individuals are still interacting with their friends and loved ones. And these are individuals you trust, you love. And so you may take it for granted that they are COVID negative, but you're not sure. So right now, we are not sure of anybody's COVID-19 status. So it may be a friend or a loved one, but you still need to take the necessary precautions. Wear your face mask when you're going to drop off food for your mom. Maintain a safe distance. You put down the food, she sanitizes it, she washes her hands, and then you leave. You need to maintain that safe distance, even between co-workers, friends, and loved ones. Because the contacts we are picking up are friends of cases, relatives, close relatives of cases. So what it is telling us is that within your family network or social network, individuals are dropping their guard. They are not adhering to the non-pharmaceutical measures. So, ladies and gentlemen, you're interacting with your friends, your loved ones. You need to wear your face mask, sanitize your hands after touching high-touch surfaces. Maintain a safe distance of 6 feet from others. The others may include your co-workers. If you're an essential worker, it may include your close friends, your loved ones. We need to keep calm, maintain a balance in this stressful time. We need to empower ourselves with the facts about COVID-19. We need to empower ourselves by the facts about the COVID-19 vaccine. This may sound contradictory, but this is what it means to live with COVID. This is the new norm. We are social beings, so we are asked to stay connected safely with friends and family and loved ones. We need to be innovative in so doing. Take care of your body, boost your own immune system, making sure you eat well, eat healthily, lots of fruits and vegetables, maintain adequate hydration, drinking adequate amount of water, make sure you rest. So take care of your body and boost your own immune system. And of course, monitor yourself for the COVID-19 symptoms. And if you recognize any of these symptoms, make sure you get tested and get care. Protect yourself against COVID-19. Do not wait, vaccinate. Do not wait. Make sure to adhere to the non-pharmaceutical measures. Thank you.